It's a nice sunny day, and it was a nice sunny day when we went out to Essex, from what I remember.
Yeah, it was great there.
And it was nice and sunny when we were doing a bit of filming around Camden as well.
Yeah, we've been pretty lucky, yeah.
It was an experience, wasn't it?
Definitely an experience, and it gives you a chance to see the other side of family group conference.
Yeah, I feel that as well.
Yeah.
We met all those people that had an experience of family group conference as well.
Yeah, they did, yeah, and they were very positive with their feedback.
Why did you want to get involved in the first place in the film?
My family had a family group conference for my nephew, and it really helped, and 100%. And I wanted to get the message out to other people to tell them, don't be afraid, seek help, it can and will help.
What I liked about the family group conference was that I didn't feel so alone. I felt like, I had support, and it was clear to me that the support was shared. I had a shared support that I could rely on.
Why did Camden want to make this film, Tim?
Well, I think we were lucky to be able to collaborate with Birmingham University and Essex. I think for Camden, our experience was the same as yours, Sandra, that we had worked with children and children's social workers primarily. So to be able to show that it's something that can work for everyone, that FGC can be good for that vulnerable older person, and that FGC might be good for somebody that needs to plan support for a learning disability or physical disability or a mental health issue, we were really keen to show that. We were keen to show that it can be good for planning care, it can be good for gathering support, it can be good for keeping people safe as well. So to take that chance to showcase not only what we do here in Camden, but also the good work that's going on in Essex, and to share that with social workers and with others.
Hi, I'm on the train going to Essex to see how they run their family group conference meetings and to see if they differ from the way we run ours. Okay, so here I am at the Chelmsford and Essex Centre.
When you get, you've got mental health problems, there is still that stigma.
Yeah,
even years and years on.
Yeah.
And to be able to sit there and say to my children, it's fine, yes, I do have a mental illness, but it's under control, and with the help of all these other people, they're going to support you, I'm going to support you, and we can move forward. And it has done a lot for my recovery. It's just like, these are the facts, this is what we need to focus on. What do you feel you can do to help?
Yeah.
So it was just getting everybody on the same page, and just everybody could talk, everybody could ask questions, and just to explain things, and just it gave me a platform to be able to explain things. It was all very much me taking control of it, which was quite nice as well, because being in the place that I was, I didn't feel I had a lot of control over anything.
But I think the initial family conference,
Because it comes out into the open.
Yeah,
you're not alone.
No.
It comes out in the open, and it's so much easier to talk about problems.
Oh, and having a mediator, having someone else to mediate. We had it that what was said in the room stayed in the room.
I think it's really hard to tell family
how you
really feel. It's so much easier to tell an outsider.
Yeah.
And that's why I think the family group conference is so good. It's not just you.
No, everyone.
Everybody's involved.
Yeah.
And that, I think,
there's no spotlight on the
it.
individual.
No, it's not. Be careful what you're saying. No. It's, everybody's involved.
Yeah.
And everybody's helping.
I think we had tears.
Of course.
I had tears.
Screaming matches.
Shouted. But it was really good. It needed to be done. It was almost afterwards you feel relieved.
It's relief, isn't it?
The weight's been taken off your shoulders, and
because you're not alone.
Yeah,
and that's the main thing.
And I think that was the problem that we felt, even as a family, with Irana.
You knew
that you're on your own.
Yeah.
And then all of a sudden, this service clicks in, and you think, oh wow.
At the heart of what we do is the belief that
you can't transform a situation if you're working with an individual. It's very difficult. There's a lot of reasons for that. There's a lot of barriers in terms of misunderstandings, lack of communication, just general difficulties in networks, whether it be professionals are struggling or family members are struggling. And we believe by meeting with the entire network and bringing a bit of hope into the situation, but also by identifying where, just if you can mediate a little bit in terms of some of the difficulties that are going on, whether it be with the family and professionals or whether it be within the family network, that you can bring any family together. And certainly we've found a lot of people in mental health will liken something like this to family therapy, but it's hugely different. And that it's much more practical based. It's much more about going into people's homes, working with people individually first of all to prepare them for that meeting. And then when people feel truly ready to sit down and discuss the issues at hand and feel supported to do that, then we will actually bring people together to do that.
It's about the families making the decision, really, and it's about their support plans with us as professionals and coordinators as kind of guiding them through that, really.
My name is Azara, and I've been organising family group conferences since 2004. For the last 3 years, I've been organising adult family group conferences in Camden. First of all, the social worker will ask the adults if they would like a family group conference. Then, as the family group conference coordinator, I'll contact all the family members involved to organize the family group conference. On the day, everybody's voice is heard. Professionals share information at the start. Then, the crucial bit of the family group conference, the professionals and I leave the meeting. Then the adults and their family have time on their own to work out their plan.
I'm trying very hard. I know.
Yeah, okay, go.
Did you get your sheet back?
No, well, I've got one back.
For the family group conference, it's about us all coming together, you as a family, to make a plan written down. And what we said, we'll even put some of the points on top of his fridge so that he sees them every day.
Families get so confused, and I think it's bad enough for practitioners, but confused with all the different people that are involved in people's families, all the different professionals. So having the time at the beginning where all the professionals were there and they could ask questions, and it was completely transparent and honest, and the professionals were honest with each other. So I think that really helped the family then to go into their family time, because they knew what the limits were as well, and where the responsibilities lied for all the professionals.
And it's almost like a dance between the client. At one stage they're all going for it, and then they pull back, and then one goes forward, and then they come together.
I'm still mindful of that piece of work and how the family group conference was the solution to a sticky point, most definitely. And it made me very aware of several of my other cases, and particularly cases that we're working from a strengths perspective now with our innovations approach to work, and how we can apply that same family group conference ethos by empowering the individuals and the family members, or the chosen people around them to support a solution.
I think sometimes the FGC will give the carer a voice and they actually feel listened to.
Yeah.
You know, because quite often they're struggling and at the end of their tether, and they feel that nobody's listening. And I think in FGC they really can feel heard. So as well as focusing on the adult that the FGC is about, I think it can actually kind of be very helpful and supportive of the carer and reinforce their role so that they feel more able to carry on doing it.
One person at the end of the meeting also said that this is what adult social care should be like. And again, I think it's about the kind of non-judgmental, and it kind of, you know, people actually being appreciated as people and as, you know, subjects.
There was more family involved in than what the social worker at the time had managed to be able to connect with, But with the FGC, there was other family members that came in that really changed the whole dynamic and really got things moving.
So in Camden, we're really excited about the potential for extending the work we've been doing with family group conferencing in children's services to the world of adults. We think there's real potential for developing our strengths-based practice in a way that really engages with families and empowers individuals and families. We're also very keen to be a part of a learning community, and therefore to take the learning from the work we're doing and to share that with others, so that we can really begin to inform practice more generally.
Can you tell me about your involvement with family group conferencing?
I really was impressed by what family group conferencing does, and it really links into the work that we're doing in adults, which is about working with people's strengths, linking people into their communities, and really trying to empower people and kind of decrease their dependency on social services. So the idea of a family group conferencing where social workers give up some of their role and there's an independent coordinator, but it gives far more power to families and friends, people close to someone, to sort out their issues, was a really attractive idea.
There is a growing body of research about using family group conferences with adults. It shows that they produce plans that keep people safe, helps individuals feel more in control and groups more resilient. FGCs are restorative and help manage conflict. They can be more culturally sensitive, and they are valued by the people that use them. They produce personalised plans drawing on resources from family and friends. FGCs can save agency resources and build trust between agencies and the people they work with.